Close your eyes and imagine that you're not a healthcare worker, but that you're a patient in an ER. The ER is cold and you're lying on a very uncomfortable cot. You have a huge rubber band wrapped around your arm that you feel is cutting off your circulation. The nurse has hardly spoken 2 words to you, and she's waving around a large needle. Would you feel anxious? Research states that using Aidet, a simple acronym, is beneficial because it can relieve anxiety in patients, and if used by all staff members, can improve patient satisfaction. I'm going to cover 2 points today. The first point, per Stephanie Baker, is patients' anxiety can be reduced by using direct, decisive words that can give them and their family confidence in your ability to take great care. The second point, per Studer, concerns increasing patient satisfaction. If every staff member uses Aidet, from the housekeeper to the CEO, your patient satisfaction scores will increase, and will also have customer loyalty. What exactly is Aidet? According to Diker House Nuss, it is a simple tool intended to help medical staff communicate more efficiently with patients, families, and each other through scripted communication that creates order, respect, and consistency. Aidet stands for knowledge, introduce, duration, explain, and thank you. This presentation will explain Quint Studer's framework for Aidet to help staff communicate with patients and their family, as well as each other. It is a simple acronym for Fundamentals of Service, but a powerful communication tool used to calm people who are feeling anxious, nervous, and scared. This chart shows you that there are 5 fundamentals of Aidet that can be thought of as puzzle pieces to complete your patient's perception of care. Acknowledge is the first piece of the puzzle. Make eye contact and smile. Acknowledge the patient by his or her last name. An example would be, "Good morning, Mr. Smith. Welcome to our ER." Introduced is the second piece of the puzzle. Introduce yourself to the patient. Tell them your name, title, and skill set, and your work experience. This way, the patient knows who you are and what level of care you'll be giving them. An example would be, "My name is Renee Farrell. I'm going to be your nurse today. I have been in the nursing profession for 30 years, and mostly in the ER. I'm going to take great care of you." This is also a good time to manage up. You're sharing positive things about your coworkers, shows them that you have a connected and united team, and they'll be caring for them. You could say something like, Dr. Johnson is your doctor today. I've been working with him for 5 years. He's a great doctor. You're in excellent hands." The third piece of the puzzle is very important. It's duration, and simply means keeping the patient informed. When patients know how long a procedure or test will take, it eases their anxiety and helps them become more compliant with their care. Example, "Mr. Smith, we'll be running some labs today. We'll be doing some x-rays, and we'll probably give you fluids to help hydrate you. You will probably be in our ER for about 3 to 4 hours. Explanation is an important fundamental in communication. It connects back to anxiety and patient satisfaction. When a patient understands the what, why, and when, their stress is reduced, and understanding the reason behind procedures, they are confident in their care. We are sending you for an x-ray for your chest so we can see it better. The test is not painful, but you'll be asked to lay very still on an x-ray table. Jason is your x-ray tech. He's been doing this for a long time, so you'll be back with us in about 15 minutes. The final fundamental stands for thank you. This can express appreciation to the patient, and you can do this in several ways. You can say, "Thank you, Mr. Smith, for allowing me to take care of you," or "Thank you, Mr. Smith, for choosing our hospital as your health care provider." According to Baker, communication with patients is fundamental to decrease anxiety and reduce stress. Thoughtful, standardized, scripted communication to every patient every time is important in sustaining success, not only for patient satisfaction, but also for loyalty. Using Aidet can and will improve patient satisfaction, and it has been proven that using Aidet saw a significant increase from 5 to 20% in their overall patient satisfaction scores. According to Studer, Robinson, and Cook, hospitals that are responsive to patients' needs, instill confidence, will have very satisfied and show a noticeable increase in the hospital's Consumer Assessment of Healthcare Providers system, which is short for HCAPS. In conclusion, when staff members follow Aidet guidelines, the patient's anxiety will decrease and patient satisfaction will increase. In summary, using Aidet is effective in relieving anxiety in patients and keeping the patients informed and instilling confidence. Patients' perception of care will increase, and patient satisfaction with every staff member that follows the Aidet guidelines. Arming the patient with knowledge of their caregiver's level of expertise as their co-workers reduce anxiety. This will increase their level of understanding of procedures and feel comfortable with the timeline provided. Patient satisfaction should be the goal of every healthcare worker, and increase communication among healthcare workers. Are there any questions today?
Do I have to use Aidet in any type of order?
You don't have to. Of course, if you're just meeting the person for the first time, you should acknowledge and introduce. But if you've already done that and you're going back in, you can talk about duration or explain, or if you're finalizing their care, you can go in and thank them.
How can I give a duration when I don't know how long a procedure or test will take?
You would estimate. The patients really don't expect an exact time. So if you know about how long, for instance, the patient is going to go to x-ray, and you know it usually takes about 20 minutes for that particular x-ray, you can estimate and say, you'll probably be gone about 15 minutes.
I've only been a nurse for a short while. I don't want to scare them by telling them I'm a new nurse. What should I say?
I would include your school that you've had. Let's say you've had 4 years of school. You can tell them you've been in the healthcare field for 4 years. You can also make sure this is time to manage up. And you can say, I have great preceptors who will help me in any way I need, and they'll be there for you if you have any questions for them. Thank you.